Hi y'all! Welcome back to the channel. Today we're continuing to discuss the differences between straight Medicare and Medicare Advantage, also called replacement plans, and which will be better for you specifically. I've spent 15 years in the healthcare industry, working directly with insurance companies as well as direct patient care. I've seen firsthand how confusing insurance can be and how the right or wrong plan can seriously impact people's healthcare and their wallets. Let's go. Understanding Medicare Advantage. In Part 1, we covered everything you need to know about straight Medicare. If you missed Part 1, I'll link it down in the description below and also at the end of this video. But for now, let's talk about its alternative. Medicare Advantage, also known as Part C. What is Medicare Advantage? These are plans that are run by private insurance companies like United Healthcare, Cigna, Humana, and Aetna, etc. When you sign up for one of these plans, you're no longer on straight Medicare. Instead, you're under a private insurance company's version of Medicare. So, what makes a Medicare replacement plan so attractive? Well, there are many ways these companies advertise to seniors. I'm sure you've seen all the commercials out there, enticing you with a plan and without even knowing your specific needs. So let's find out why. Medicare Advantage plans bundle Part A, Part B, and often Part D, which is the prescription drug coverage, all into one convenient plan. Plus, many Advantage plans include extra perks like dental, vision, hearing, and even transportation services. Sounds great, right? But let's dig a little deeper. These companies get paid thousands of dollars per year, per enrollee, by the government. And trust me, they're not losing money on this deal. Their goal? Make a profit. And they do that by denying claims, limiting coverage, and making it harder for you to get care. One of the biggest selling points of a Medicare Advantage plan is that some plans have a $0 monthly premium. Well, that sounds amazing, right? Who doesn't love free healthcare? But there's a catch. Yes, the premium might be $0, but that doesn't mean your healthcare is free. These plans come with high out-of-pocket costs, including co-pays, deductibles, and co-insurance. They have a strict network, meaning you might not be able to see the doctor or specialist that you want. Many plans also require pre-approvals, meaning prior authorizations for things such as tests, treatments, and even basic procedures. There are also different types of Medicare Advantage plans, such as HMO, Health Maintenance Organizations. These plans require a primary doctor and referral for specialists. It has a lower cost, but a more restricted network. There's a PPO, Preferred Provider Organization. They offer more flexibility, but at a higher out-of-pocket cost. There are some special needs plans as well, called SNPs. These are tailored for people with specific conditions, like diabetes or other chronic illnesses. With Advantage plans, you typically have co-pays instead of co-insurance, which makes costs more predictable. In other words, Medicare Advantage is like a pay-as-you-go system. You might save money if you're healthy, but the second you need serious medical care, you're hit with surprise bills and denied services. Insurance companies love Medicare Advantage because they control your care and they decide what they will and will not pay for. Did you know? There's a 2022 report by the federal government that found insurance companies like Medicare Advantage denied millions of necessary treatments and services, even though Medicare would have covered them? So how'd they do it? They require pre-approvals for expensive treatments, knowing many people won't fight back. They deny claims as often as possible, hoping patients will give up instead of appealing. They limit networks, so you're forced to use their preferred doctors and hospitals, even if they're not the best for you. This means that even if your doctor wants to order a test or a treatment, your insurance company can override their decision. Not because it's unsafe, but because it costs them too much money. So what are some of the pros and cons of this Advantage plan? Lower premiums in some cases, additional benefits such as dental and vision, and the cons: network restrictions, they require prior authorizations for some services, and the plan changes every single year. If you travel often or want flexibility, then choose straight Medicare. If you want a plan that includes extra benefits, then consider an Advantage plan. But what is the real cost? Many people choose Medicare Advantage because they think it's cheaper. But let's compare the actual costs. Straight Medicare plus a medigap plan offers higher monthly premium, but there are no networks. You can see any doctor at any time, anywhere, and there are no pre-approvals. Medicare pays automatically. Predictable costs, and most expenses are covered. Medicare Advantage offers a low or zero monthly premium, but high out-of-pocket costs. But they do have limited networks. Your doctor and/or hospital may not be in their network. Denied claims and prior authorizations, and insurance companies control what's covered. So, while a Medicare Advantage plan seems cheaper up front, it can actually cost you more in the long run, especially if you get sick or need major medical care. At the end of the day, the biggest winners in Medicare Advantage is not our community, it's the insurance companies. They're making billions in profits every single year by collecting government money while cutting costs on patient care. Think about it. If Medicare Advantage was really designed to give you better care, why are they denying treatments, forcing people to fight for coverage, and making it harder to see the doctor of your choice? Because their goal isn't to help you, it's to make money. And the less they pay for your care, the more profit they will make. So, should you choose straight Medicare or Medicare Advantage? That's what you really want to know. Well, that depends on what matters to you the most. If you want freedom, flexibility, and predictable costs, then straight Medicare with a medigap plan would be the best option. If you're willing to deal with restrictions, high out-of-pocket costs, denied claims, Medicare Advantage might seem more appealing. But before you make your decision, ask yourself, do I really want an insurance company controlling my healthcare? Well, now that you know the truth, what do you think? And again, if you have any questions at all, please feel free to ask them in the comments, and I will do my best to answer. And if you found this helpful, please share it with anyone who may need it. Thank you for watching, and I'll see you next time. Be well.